Hey, I'm Dr. Matt Alexander, and today I wanted to talk about a test that's very near and dear to my heart, and that's the Dutch test. And the reason why I want to talk about the Dutch test is because it's one of the most common tests that we use in functional medicine, and it really gives us a ton of great information on what's going on inside your body. So, first, I want to discuss who is a good candidate for the Dutch test. And really, pretty much anybody that's having chronic problems with their health that can't be hasn't been figured out yet is a good candidate for the Dutch test. And the reason why is the Dutch test is really it's a hormone test. It tests sex hormones, adrenals. It looks at some metabolites for neurotransmitters, and it does a lot of cool stuff. So um, hormones are really what's controlling a lot of what's going on in our body. And when they get out of whack, it can affect a lot of things. It can cause mood disorders, depression. It can cause postpartum depression. It can cause fatigue, difficulty sleeping, difficulty getting to sleep, and difficulty staying asleep. Hormones can cause problems with gut. There's even GI disorders that hormones can play a role with. There's just a whole ton of problems that can happen when our hormones get out of whack and they're not signaling things properly in our body. So what is the Dutch test actually testing? So the Dutch is a dried urine analysis, and it's really easy. You take 4 to 5 different, you pee on a little thing a few times a day, and then you send it in. And the nice thing about the Dutch is that the strips that you pee on, they actually keep for a few weeks. And they've done testing to see how well the dried urine compares with liquid urine, and it's actually very, very close, very similar. So the nice thing is you can do the dried urine analysis at home and send it in, and the results are still going to turn out really well. And so that's part of the reason why I like the Dutch so much. So what it's actually testing is it's looking at sex hormones. It's looking at your adrenals, specifically cortisol. It's looking at some neurotransmitter metabolites, so we can tell how your dopamine is doing in your brain, and serotonin and melatonin. And those are things that we're going to use to help us figure out basically a regimen to balancing out those hormones. So if you say you had really high testosterone or estrogen in a woman and really low testosterone, that could affect libido. It can affect mood, anxiety, things like that. So there's certain supplements, natural supplements, and hormones that can be given, hormone replacement therapies that can be done. So the Dutch test is actually a great test that can be used for monitoring hormone replacement therapy. And so as we kind of balance out those hormones and the body starts signaling properly, um, you know, a lot of those issues can start to resolve. So that's why I like the Dutch test so much. It just gives us so much information. Specifically with the cortisol and sleep cycle, there is a component to the Dutch that can be added on that's called the CAR, the cortisol awakening response, and that's actually a saliva test. And the cool part of that is that can be done right at home too, and it's very easy. So for all of those reasons combined is why I like the Dutch test so much. I think it's a fabulous test, and I do it on most of my functional medicine patients. And if that's something that you're learning about and interested in, and you're not already a patient of mine, you can go ahead and hop on our website as listed below in this video, and you can schedule a new patient appointment with me. Typically we do them over the phone, especially now with the pandemic going on. So thanks for watching, and hopefully this helped you in some way.